County has tested more than 1,300 people for COVID-19. The health commissioner says we should be testing far more. Atia Collins joining us now. Atia, how prepared are we to handle the growing number of COVID-19 cases here?
Well, Maureen, the County Department of Public Health is still working on that. Now, testing, hospital beds, and medical equipment are all things they're focusing on, and they say we need a lot to handle the growing outbreak in our area. And today, the County Commissioner, Dr. Michael Mendoza, said we aren't where he'd like us to be. Here at Rochester Regional Health, testing is still going on late into the night. So far, there have been 1,340 COVID-19 test results processed by the Monroe County Public Health Department, with 81 positive cases. But there is still a shortage of tests, something Dr. Michael Mendoza says is impacting our efforts to control the virus.
The capacity for testing is still not where we would like it to be. If I had our way, we would test far more individuals than we currently are. And the consequence of that, of course, is that we are now underreporting the total number of cases here in the county.
The current test available is a PCR test. But according to Dr. Mendoza, we do not have a test that can tell whether someone had the virus, which makes it harder to gauge community risk.
In the future, our hope is that we'll have an antibody test that will act in many ways like the measles or the mumps antibodies, where once it's positive, in theory it should always be positive, indicating that you've had a prior infection or a vaccine, which we don't yet have for this.
The county has looked at things like recovery facilities and outpatient centers and the possibility of a surge of COVID-19 cases.
We're asking each hospital system to develop a plan that outlines the number of beds that would be available, sort of in concentricals, if you will. What number of beds would be available in X number of time. How many more beds and resources can you add if you add in another week after that, and so forth. So we have the ability to predict going forward the number of resources that we'll be able to have as a community. So as far as timeline goes, we're still working on that.
Now, as far as testing, the county is prioritizing hospitalized individuals, first responders, and healthcare workers for the COVID-19 testing. Others are being asked to consult with their primary care physician for a referral for testing. And while that criteria for testing sounds narrow, Dr. Mendoza did say there has not been any sign that they haven't been able to test those who needed it. Reporting Atia Collins, News 8.
All right, Atia, thank you. And a reminder, testing upon request is not available at this time. If you show up at the drive-through testing site without a referral from your doctor, you will be turned away.